Hey everyone, welcome back to Radiant Health. If you've been noticing more hair in your brush or shower drain, you're not alone. Today, we're talking about why hair fall occurs and what you can do to combat it. Let's dive in. Firstly, we have to know what are the common reasons for hair fall. There are several factors that can contribute to hair loss, including genetics. If hair loss runs in your family, you might be more prone to experiencing it. This type of hair loss is often referred to as androgenetic alopecia or pattern baldness. Hormonal changes. Hormonal imbalances, such as those caused by pregnancy, menopause, or thyroid issues, can lead to hair fall. Nutritional deficiencies. A lack of essential nutrients like vitamins A, D, E, zinc, and iron can weaken your hair and cause it to fall out. Stress. High levels of stress can trigger a type of hair loss called telogen effluvium, where hair follicles prematurely enter the resting phase and fall out. Medical conditions. Conditions like alopecia areata, scalp infections, and chronic illnesses can contribute to hair loss. Hair care practices. Overuse of heat styling tools, harsh hair products, tight hairstyles, and chemical treatments can damage your hair and lead to hair fall. These are the common reasons for hair fall. First of all, you have to know what are the stages of hair growth and which stage you are in now. Hair grows in 4 distinct stages. The final stage involves the shedding of old hair, making room for new hair growth. Certain conditions can disrupt the stages of hair growth. The growth and loss of hair may seem like a simple process, but the hair growth cycle is actually composed of 4 distinct phases. These stages of hair growth have been studied in great depth to better understand how hair grows and what might be done to prevent or treat premature hair loss. 1. Anagen 2, catagen 3, telogen 4, exogen. Each phase has its own timeline, which can be affected by age, nutrition, and overall health. That means there are steps you can take along the way to help ensure that your hair follows a healthy growth cycle. First is the anagen phase, also known as the growth phase. This is the most active phase where the hair follicle is producing new hair cells, and the hair strand is growing longer. The anagen phase can last anywhere from 2 to 7 years, depending on genetics and other factors. During this phase, hair grows about half an inch per month. You'll notice that your hair is thicker, longer, and generally healthier. Proper nutrition and hair care during this phase can maximize growth potential. You notice in this stage, your hair condition is, look for consistent hair growth and healthy, shiny hair. Next is the catagen phase, which is a transitional stage that lasts about 2 to 3 weeks. During this phase, hair growth stops, and the hair follicle shrinks and detaches from the dermal papilla, which is the structure that supplies nutrients to the growing hair. You might not notice significant changes during this short phase, but it's an essential part of the hair cycle as the follicle prepares for the next stage. You notice in this stage your hair condition is minimal changes, but maintaining scalp health is crucial. The telogen phase is the resting phase and lasts about 3 to 4 months. During this phase, hair follicles are dormant and no new hair growth occurs. The hair strand remains in the follicle but is not actively growing. You might notice some hair shedding during this phase, as the hair is no longer anchored firmly in the follicle. It's normal to lose about 50 to 100 hairs per day, so don't be alarmed if you see some hair in your brush or shower. You notice in this stage for increased shedding, which is normal. Focus on gentle hair care routines to minimize breakage. Finally, we have the exogen phase, which is part of the telogen phase. This is when the old hair strand is shed and a new hair begins to grow in its place. The exogen phase can overlap with the telogen phase and typically lasts a few weeks. During this phase, you'll notice hair shedding, but it's a sign that new hair growth is starting. Proper scalp care and gentle handling of your hair can help minimize excessive shedding. You notice the shedding of old hair and the beginning of new growth. Support new growth with proper nutrition and scalp care. Now we have to know how to clear this hair fall. Here are some effective strategies. 1. Maintain a healthy diet. Eating a balanced diet rich in vitamins and minerals is crucial. Incorporate foods high in vitamins A, C, D, E, zinc, iron, and omega-3 fatty acids. Think leafy greens, nuts, seeds, fish, and eggs. 2. Reduce stress. Practice stress-reducing activities like yoga, meditation, exercise, and deep breathing exercises. Keeping stress levels in check can significantly impact your hair health. 3. Gentle hair care. Avoid excessive use of heat styling tools and harsh chemical treatments. Opt for gentle shampoos and conditioners, And be mindful of not pulling your hair too tightly in ponytails or braids. 4. Scalp care. Keep your scalp clean and healthy. Regularly massage your scalp to stimulate blood flow, which can promote hair growth. You can use oils like coconut, jojoba, or rosemary oil for added benefits. 5. Avoid overwashing. Washing your hair too frequently can strip it of natural oils, leading to dryness and breakage. Aim to wash your hair 2-3 times a week. 6. Medical treatments. If your hair fall is severe, consider consulting a healthcare professional. Treatments like minoxidil, finasteride, or even PRP, platelet-rich plasma therapy, might be recommended. Remember that minoxidil is an over-the-counter medication that's widely used to treat hair loss. It's available in various forms, including liquid solutions, foams, and sprays, and comes in different strengths, typically 2% and 5%. Finasteride available in pill form and is often sold under the brand name Propecia. Originally, it was developed to treat enlarged prostate glands under the name Proscar, but it was later found to be effective for hair loss. Platelet-rich plasma is a treatment that uses your own blood to stimulate hair growth. I will explain detail about minoxidil, finasteride, and PRP in next video. Stay tuned with our channel. Let's make a simple and nourishing hair care to help strengthen your hair and reduce hair fall. Here's a remedy 1. Take a hibiscus bud or flower and apply it to the scalp daily, or at least thrice a week to see the best results. Remedy 2. Let's see how to prepare rosemary oil. This rosemary oil is fantastic for promoting hair growth, improving scalp health, and making your hair look and feel amazing. Here, you'll need ingredients like just a rosemary leaves and a coconut oil. Take a bowl, fill it with water for steaming it for 5 minutes. Take another bowl, put it on a steaming water. Take rosemary leaves, place on it, followed by coconut oil for 6 minutes. After the coconut oil changes to green color, oil should be strained from rosemary leaves. Then it will apply to your hair and scalp. Leave it for 2 hours and then wash with shampoo. The main advantage of this oil is rosemary oil contains 2% minoxidil, which is good for your hair fall. Remember, addressing hair fall often requires a combination of good nutrition, gentle hair care, stress management, and sometimes medical intervention. Be patient and consistent with your efforts, and you'll start to see improvements over time. If you found this video helpful, please give it a thumbs up. Subscribe to Radiant Health, and hit that bell icon to get notified of new videos. Thanks for watching, and see you next time.